Welcome back, everybody. Intermountain Healthcare, working with communities to address opioid use disorders. We have Dr. Dean Mayer here with Intermountain Healthcare to talk more about what they are doing to combat this crisis. And Doctor, what I really like is that this is a community effort. There's not one solution. We're kind of attacking this on a bunch of different levels. Correct.
Yeah, and I think it starts from the provider end, where we're trying to reduce prescriptions, and we at Intermountain are monitoring prescription use and those going out with prescriptions, and we limit them.
Which is important because I think you've kind of got two categories of people. One who, okay, I might need this, but another group who, if you go down that rabbit hole, it can kind of become a problem.
Very much so, and I think it has. Back in the 1990s, you know, pharmaceutical companies were pushing for opioid prescriptions to treat pain, and now we've gotten into trouble with the opioid crisis and overuse and misuse.
And for people who are going in to be treated, you're not going to they're not going to be in pain. You're going to take care of them, but just going to be in a careful and very good way.
Yes, very careful.
Now,
and I think the back end is that some people that are already on opioids long term for pain, there is a effort to help them look at different solutions.
Which there are so many of them.
Correct.
Now let's talk about helping someone who might be in crisis and might have an addiction. You're also helping on that side of the problem as well.
Yeah, with Intermountain's help, we've developed a program with patients who are injection drug users, and with that injection, they develop infections that are bloodborne. Sometimes they're skin, but bloodborne, and they seed into areas like the spine and the heart. Very serious infections that require prolonged antibiotics to treat. But what we didn't do in the past is we didn't treat their opioid addiction so much in the hospital. We were not very well adept at that, and I still think we're behind on it. But you see patients who come in with withdrawals, and we need to treat those because those withdrawals lead to lack of compliance with their treatment, and oftentimes they leave against medical advice. So once you treat that whole person with the withdrawals and then treat the intravenous, the infection with intravenous antibiotics, and know that long-term antibiotics need a solution from hospital to a community setting.
And you're taking care of that all now at Intermountain.
Yes, and we took care of that with a long-term development of a program where we've partnered with Odyssey House and Volunteers of America, where we have a safe place for these people to go to get intravenous antibiotics, because putting them out in the community with a PICC line, there's a high risk of abuse of that PICC line. And PICC line is a long IV that's utilized for long-term use of antibiotic injections.
And I think this is the interesting part about all this, is that Intermountain, while they're taking care of the problem within, also going to the community and using the resources outside. And talk about how that's also a great part of the solution.
Part of the solution, because again, we talk about the opioid crisis with prescriptions, and that's the front door. The back door is treating these patients that have become addicted, not just from the prescriptions, but from other means, recreational use or treating their psychiatric disorder. So, you know, putting that all together, I think the big picture is treating the addiction, and then the result of the addiction oftentimes is the infections. And so these partners really help us tie that together with our home health agencies to help treat that. We are actually in the process of moving our programs into the north geographic regions and the south geographic regions to help with that. And we just have to partner as a team and find the resources to hand off from hospital setting to the community.
Which is such an important thing, and it's so fantastic that it's happening. Thanks so much for being here today.